People first. People who just happen to have kidney disease. Owen's final comment in the video sums up why I support Northwest Kidney Centers and why we are all together today. I am Raghu Durvasula, and as a nephrologist for nearly 20 years, I've seen countless patients like Owen, whose lives have been enriched by Northwest Kidney Center's commitment to treating them holistically, like people, not just numbers to be counted on dialysis reports or boxes to be checked during compliance audits. I was introduced to Northwest Kidney Centers on the very first day of my nephrology fellowship at the University of Washington in 1999, when Joyce Jackson came to an orientation session. I knew right away that this was a special organization, one that would be my partner in caring for my patients. I also benefited personally from a research fellowship supported by Northwest Kidney Center's dedication to training the next generation of kidney disease specialists. When Joyce asked me last year to join the foundation board, I jumped at the opportunity to support an organization that has done so much to support the health, quality of life, and independence of people with kidney disease. Now, through the years, I've discovered there's still a lot I don't know about managing kidney disease. You see, as a physician, I'm trained to look at data, interpret it, and react to it. I'll often see a patient whose blood pressure is elevated, whose potassium or phosphorus levels are running high, or whose blood sugar is not well controlled. I can advise him to moderate his diet. I can tell him to get more exercise. I can prescribe medications to help. I can explain in detail how his health may suffer if all those conditions can't be managed. It's easy for me to explain the why, but it's a lot harder to explain the how. How do you take my seemingly straightforward instructions to adhere to a low salt, low potassium, low phosphate, and hopefully not low flavor diet and make it realistic and sustainable? Physicians just don't have the training to translate their own advice into what a patient should buy at the grocery store, cook in his kitchen, and eat from his plate. That's where Northwest Kidney Centers and you come in. Thanks to your generosity, the dietitians and social workers at Northwest Kidney Centers can augment my best medical care with their best guidance about food, fitness, and lifestyle. I see the impact of their expertise each and every day with my patients. A couple of months ago, I visited with one of my patients at a dialysis clinic. We'll call her Ava, a lively 30-something-year-old woman who loves to cook and enjoy meals with her son. Now, I know firsthand what a good cook she is because she shared her delicious tamales with me. Ava has been doing great since starting dialysis, and her appetite has improved dramatically. Cheese is one of her favorite foods. I guess it's probably one of everybody's favorite foods. But cheese, like other dairy products, is high in phosphate. I cautioned her about the long-term dangers of high phosphate and how it may promote cardiovascular disease, the #1 cause of death among people with kidney failure. A few weeks later, I visited Ava again while she was on dialysis, and I found her talking with the Northwest Kidney Center dietitian, who had engaged a Spanish translator on the phone so that they could communicate more effectively. They were analyzing Ava's food diary and exploring ways that she could still enjoy cooking delicious recipes without it negatively affecting her well-being. Tasty, creative, healthy meals that she and her family would love to eat in a diet that honors her unique cultural heritage and that can be sustained over time. My directive to Ava to moderate her phosphate intake came to life through the care and expertise of Northwest Kidney Centers. You make that kind of holistic care possible. The kind of care that encourages every patient to make wise decisions about food and exercise. To begin with even small changes, like a walk around the block each day, that can add up to big benefits in kidney health and people's overall sense of well-being. The kind of care that empowers people to take control of their health. You are invited here today with the request that you donate at least $150 to support nutrition and fitness services, along with uncompensated care for people like Ava. I hope that each of you will consider that requested gift amount, even those of you who might be sitting at a sponsored table. We will be grateful for any donation you make of any size. But remember the touching and generous match that Joyce mentioned earlier? By donating $250, you will expand your gift dramatically. Every $100 beyond that $150 requested minimum gift will be doubled up to a total of $15,000. Think about the power you have to increase the impact you can make here today. Please consider giving at least $150 or upping your donation to trigger that generous match at $250 or more. As the table captains hand out the pledge forms, let's see if every person in the room today can make that kind of meaningful difference for people living with kidney disease. Our community has an amazing resource in Northwest Kidney Centers, one we are all proud to support. Thank you for investing today in the people they serve.